Good morning, everyone. Thank you for joining me this morning to hear about our strategic plan for obstetrics. For those of you who don't know me, my name is Lori McElwain. I am the manager of Good Samaritan Family Birth Center, and I am the lead OB manager for this project. The mission of our organization is our legacy is good health for our people, our patients, our community, and our world. We are well known in the region as being focused on community needs, values, and patient safety. To that end, in 2015, in reviewing quality data and metrics, it was identified that our obstetric units had had an increase in near miss and harm events in the past 3 years. We wanted to know why. We convened a task force to examine these cases, and after thoroughly examining each patient chart for similarities and differences, looking at time of day, looking at staffing on these units, and days of the week, several issues were identified as possible co-mitigating factors in the care of these patients. Afterwards, 2 nationally known experts and consultants were brought in to review the data, to conduct staff and leader interviews, to examine our policies and procedures, and to make any further recommendations in order to assure safe patient care. The one big contributing factor for all cases reviewed was that there was a gap in communication between the healthcare providers and the staff. The consultants recommended implementing Team STEPPS training to everyone. As you can imagine, this is a large and complex undertaking for our system. What is Team STEPPS training, you may ask? Team STEPPS stands for Team Strategies and Tools to Enhance Performance and Patient Safety. It's a systematic approach that was developed by the Department of Defense and the Agency for Healthcare, Research, and Quality in order to integrate teamwork into practice. It is designed to improve quality, safety, and efficiency of healthcare. The concepts behind Team STEPPS have many years of research proving validity and usefulness of implementing such a program. In alignment with our mission, a strategic goal was developed. The primary goal for the units is to develop and disseminate a standardized communication method in order to improve interdisciplinary communication and positively impact patient outcomes by 2018. In addition, we feel staff morale and engagement scores will increase by 2018 because they will feel valued for their contribution to the team, effort, and collaboration in assuring safe patient care. Initially, a stakeholder analysis was conducted in order to identify where our strengths and where our weaknesses lie in the various groups involved. Included in the stakeholders, we identified women's leadership, such as OB managers, Director of Obstetrical Services, hospital nurse execs, and chief administrative officers of each hospital. Also included, of course, were obstetric providers, anesthesia providers, the staff RNs, the OB surgical techs, the OB secretaries, and of course, our OB educators. A change team was then formed with leaders from each stakeholder group in order to plan and design the implementation of such an undertaking. This would best meet the needs of all stakeholders because every stakeholder will be represented. These leaders will receive the full Team STEPPS master training so that they can be better change agents among their peers. The action plan was then developed. It was decided that there will be 4-hour interdisciplinary training sessions with a mix of stakeholders at each of the sessions in order to practice collaboration in the sessions. We will offer these sessions in the evening in order to not interfere with office hours. We will level the playing field. We are establishing a culture of we and not of I. Everyone will be held accountable to each other, but realizing that this will not be a quick change. It will take time and practice. Key in this change implementation is the patient being centered at our focus. Once training is complete, each topic or tool, such as SBARC, which stands for Situation, Background, Assessment, Recommendations, and Questions, or Huddles and Debriefs, will be rolled out at 2-month intervals in order to embed the new processes into our culture. We will provide signage postings of each of the topics of the month around the unit in order to assist in reminding staff and providers what is our focus. Then we will work on follow-up and sustaining. In order to follow up and sustain in such a large interdisciplinary change, we will need to do several things. First, we will practice using the tools. We will celebrate even small successes and post them weekly. What are our successes? And we will reward the staff or providers who bring forth a success. We will conduct a survey monkey at 6 months and 12 months after implementation. We will ask such things as, how often are you using the tools? What barriers have you encountered? Can you name one success? And do you think collaboration has improved overall? We will collate and report and post these results of the survey. Then the change team will look at all barriers identified and make adjustments in tool usage in the plan, do, check, act methodology to assure continuous improvement. And lastly, we will monitor eye care patient safety reports, collate them, and report out monthly at OB Exec Council. As said, this is a large change implementation for an organization, but it's the right thing to do. Through implementation of Team STEPPS, we can meet our mission and strategic goals as long as we remain patient-focused, we involve stakeholders, and we work on improving communication. Thank you for your time this morning. I will now be glad to answer any questions that you have.